Welcome to this webinar on community inclusion and solutions. In it, we'll present ways to forge relationships with community resources and businesses to help integrate elders with intellectual and developmental disabilities, or IDD, allowing them to participate more meaningfully in their communities. We'll present an overview of why and how to go about building community relationships, and we'll also provide several resources to help get you going, or to support your ongoing efforts. Communities grow when they celebrate diversity, seeking out and welcoming even the most hidden members. In recent decades, people with intellectual and developmental disabilities have increasingly become integrated into their communities. They are your neighbors. They may work and shop alongside you. And as these individuals age or develop dementia, we need to ensure that they remain included in our communities. For people with IDD, their quality of life will be greatly improved by using various resources that are available, and including them helps raise awareness, reduce fear, and foster meaningful relationships. It also reduces the potential for redundancy in services. For example, if someone with dementia would benefit from a social group, such as a memory cafe, look for resources in your area. Rather than starting from the ground up to build a social group, there may be an opportunity to participate in an existing one. And where a resource doesn't exist, look for partnership opportunities within your community. But the important thing is, by including people with IDD who are aging, we ensure that all people can participate in their communities as fully as possible. So what are some resources that could be tapped? Senior centers or service agencies that specialize in serving the needs of aging citizens, especially those that are not run by the Department of Developmental Services, are obvious places to start. But other civic and social groups may include memory cafes, recreation centers, religious organizations, and libraries. Private businesses are probably visited often, and reaching out may make for smoother interactions and transactions. Be creative. Think of things you see older people engaged in, and ask whether or not the people you serve could benefit from being involved. Finally, for those with dementia and IDD, Massachusetts has been a leader in making its communities dementia-friendly. This means that we are working toward making our communities informed, safe, and respectful so that all citizens can be as engaged as possible in their communities. Our resource list will provide a link to the Dementia Friendly America website, which has toolkits for anyone who would like more guidance in making their community dementia-friendly. Person-centered planning is utilized to determine a person's needs and identify how they will be met. So talk to your service recipients and their caregivers. What interests them? Do they have hobbies they'd like to pursue? What are their wishes related to work or retirement? What are their needs? Would they gain by having any assessment to improve functioning? Have they recorded their wishes for the end of life in advance directives, such as 5 wishes? Or have they named a healthcare agent in a healthcare proxy? What would make it easier for them to access community resources, and what can you do to facilitate this? If you're an agency director, group home manager, or caregiver, how do you start building a community network? Start by seeing what's out there for resources. Visit the Executive Office of Elder Affairs website to see what agencies serve the elder population in your area. See what your city or town offers to its members. Pay attention to businesses and retailers that might serve the needs of the people you care for. It may be helpful to talk to the Chamber of Commerce in your town. Then pick up the phone, pound the pavement, knock on doors. Set up times to visit programs and meet their staff. See what you can offer each other, and if it makes sense to foster a relationship. If you're an area agency or business serving the needs of our older community members, or are an umbrella organization representing local businesses, such as the Chamber of Commerce, you can also reach out. Visit your neighbors and start the conversation about how you may be able to meet their needs. Once you know who your neighbors are, so to speak, start working on the relationships. No doubt there will be some hesitation or fear about the unknown. A good place to start is by doing short visits to get to know one another. Knowledge often helps reduce fear of the unknown. Identify the person at the agency who is best qualified and has the authority to discuss an individual's interest in participating in a program or activity. Schedule a meeting to discuss what the person wants and needs from such a program, and whether or not the program can meet those needs. Should any adaptations be needed, be sure to clarify who will be responsible for those adaptations. Strategize about how to meet everyone's needs. As we said previously, discuss and strategize about adaptations or accommodations that might be needed, and consider also, might staffing needs change? What training might staff and employees of provider agencies need before bringing an individual to participate in a community event? What training would community resources or businesses need for them to feel confident to serve the older adult with IDD? While most businesses and community resources are now compliant with the Americans with Disabilities Act, make sure that the physical space is accessible. Evaluate physical obstacles or hazards. Are there ramps and rails? Is there adequate lighting? What's the noise level? Massachusetts is working toward making our communities friendly and safe for all of its citizens, including those with dementia and IDD. The state initiative is aligned with Dementia Friendly America, agencies in Massachusetts, as well as national organizations that have tools that can help you push this forward in your community. Identify partners in your community who would be open to engaging in removing barriers for the elderly and those with disabilities. Banks, restaurants, health clubs, and other businesses are often willing to address this need. Reaching out to community merchants and programs such as senior centers in order to educate them about how they can remove barriers in their sites to people with dementia will improve services to all their customers or clients. Convene key community leaders and members to understand dementia and its implications for your community. Then, form an action team. Engage key leaders to assess current strengths and gaps in your community using a comprehensive engagement tool. Analyze your community needs and determine the issues stakeholders are motivated to act on. Then set community goals. Act together to establish implementation plans for your goals and identify ways to measure progress. For some ideas on how to do this, check out the links provided on our resource page. In May 2016, a leadership meeting was held to address inclusion, and there were several takeaway lessons, including find ways to share existing tools and knowledge so that no one has to reinvent the wheel. Collaboration helps resources go farther. Dementia-friendly initiatives should work closely with the age-friendly movement. Regional or statewide organizations, associations, and business chains can spread knowledge and increase participation. One size does not fit all. Initiatives need to fit the local community or sector in order to be effective. Cultural inclusion requires focused attention and resources. Start with a broad representative action team and learn together about strengths and gaps to achieve sustainable results. Language matters. Use respectful, empowering, and accurate language to educate and reduce stigma about dementia. Massachusetts is emerging as a national leader, and we are part of a national movement. Dementia Friendly America offers free sector guides and an in-depth toolkit for geographic or cultural communities to follow. These materials are meant to be adapted as needed to individual community needs. Because someone is aging or is experiencing dementia does not mean that we abandon our philosophy that each individual deserves to live the life they want. Reaching out to members of the community to seek assistance in assuring that dementia will not limit their lives is invaluable. For more information on the Dementia Friendly America initiative in Massachusetts, you may contact the coordinator, Emily Kearns, at Jewish Family and Children's Services, or visit their website. These agencies and organizations provide information on general aging and dementia-friendly resources. For various businesses and service sectors, here are some useful links. This webinar is one of a series of webinars on adapting to age-related changes in the home, day program, and community, all of which can be accessed at our website or through the Massachusetts Department of Developmental Services. This training was produced by the Center for Developmental Disabilities Evaluation and Research on behalf of the Department of Developmental Services. Thank you for watching. Please visit our webpage for more trainings in the series on aging in people with intellectual and developmental disability.